My name is Jamie Champion. I am Manager of Communications with AARP Florida. Thank you all for joining us today, and I want to welcome you to this special discussion that's part of our 2021 Disaster Preparedness Series, highlighting what you need to know if your loved one is in long-term care when disaster strikes. As a nonprofit, nonpartisan member organization, AARP has been working to promote the health and well-being of older Americans for more than 60 years. And today I have the pleasure of hosting two guests, Michael Phillips, Florida's long-term care ombudsman, and Lynn Hearn, legal advocate with the Ombudsman program, to answer our questions and provide the latest information about what you need to know if your loved one is in long-term care during a natural disaster such as a hurricane. If you've joined us before on Zoom, you know this is like a live show where you can send us your questions through the Q&A feature at the bottom of your screen. We'll be monitoring your questions throughout the event, and if we can answer them during the program, we will. So let's get started. Our first guest is Michael Phillips, Florida's long-term care ombudsman. The mission of the Florida Long-Term Care Ombudsman program is to improve the quality of life for all Florida long-term care residents by advocating for and protecting their health, safety, welfare, and rights. Michael, thank you so much for being with us today. Can you share with us your perspective about the role of your office and what your team does on a daily basis to improve the lives of long-term care residents and their families?
Well, thank you, Jamie. It is such a pleasure to be with you this afternoon. You know, the Long-Term Care Ombudsman Program is a program that is established to protect the rights of residents in long-term care facilities. We're a volunteer-based organization, and we have approximately about 200 volunteers. We're always needing more, so if folks want to help join us, they're more than welcome to do so. They live in the community where these facilities are located, and so they have a vested interest in making sure that their community residents are safe in the facility. We take complaints from anyone, everyone who has an issue. We're not regulators. We're not part of ACA. We don't find the facilities when we find a problem. We just try to correct the problem. That's our role and function. We're problem solvers, and we do a pretty good job of that as well. So the interest of an individual family member who has a concern about something that's going on in a nursing home, assisted living, or adult family care home, they're free to call us, and our services are totally free. So we want to make sure that our beloved residents in the facility are well taken care of.
That's great. Thanks, Mike. We really appreciate you being here today.
Thank
Next,
you.
I'd like to introduce Lynn Hearn, legal advocate for the Florida Ombudsman program. Lynn works with Michael's team to accomplish the mission of their office. Lynn, thanks so much for joining us for this discussion.
Thanks for having me, Jamie. It's my pleasure to be here.
Wonderful. Well, let's just jump right into some of the most important questions that we hear from people across the state about disaster preparedness and long-term care. Starting with you, Lynn, what are the disaster preparedness plans and guidelines that every long-term care facility in Florida has to have in place?
Sure. I should start by saying that there are three different types of long-term care facilities that are encompassed by our program, and they are very different, and they are regulated very differently. So the first is the traditional nursing home, sometimes called skilled nursing. The second is an assisted living facility, and those are for people that require less medical care and have a little bit more independence. And then the third type of facility is an adult family care home, and those are going to be the very, very small facilities. In homes, and they have a completely different set of regulations. So, but for each of them, there's statutes and there's rules and there's criteria that are required for emergency plans. And the emergency plans are for a broad scope of emergencies. We always think of hurricanes in Florida, but could be for other types of emergencies, could be, a busted gas line in the area or something like that. So for nursing homes, there's a statute that requires all nursing homes to prepare comprehensive emergency plans, and they have to submit those to the county emergency office. And there's a rule that sets out what has to be in the emergency plan. They have, of course, anytime a facility is licensed, they have to prepare a plan. They have to submit any changes, and anytime there's a change in ownership, they also have to get approval of that plan. They are supposed to test it once a year and provide a report on how well that test went. And but it is primarily in fact, exclusively the county emergency management office that approves and houses and monitors the facility's compliance with the plan. For assisted living facilities, it's kind of the same structure. There are slightly different requirements. They do have to be approved upon licensure, approved upon a change in licensure or ownership status, and anytime there's a major change to the plan. So each of these plans has to address things like under what circumstances they would evacuate, where they would evacuate to, what types of transportation plans they would have to evacuate residents if they had to. Of course, I'm jumping to evacuation, but the preferred method of dealing with an emergency is sheltering in place. And so there are a lot of requirements around that as well. What types of arrangements are being made for emergency power if the power goes out, what kinds of supplies need to be available for food and for water and for resident medicine. So all of those are supposed to be addressed in these plans that are filed with and approved by the county emergency office. The adult family care home is the least restrictive method of approval, I should say. I mean, they actually don't have to, their plan doesn't have to be approved. They just have to have one. And it has some very minimal requirements, but it does have to be reviewed by each member of the adult family care home and all the staff and all of the family members. One of the questions you asked was, are residents able to get a hold of these plans? And the answer is technically no, but the facility is required to adopt policies and procedures to implement them. And so those, of course, would be available to the residents. And we would absolutely encourage all residents and family members to engage in dialogue with the administration at any of these facilities to ask. Maybe you can't get a copy of the actual plan that's been filed with the emergency office, but you can ask, and most facilities would be very, very willing to share as much as they possibly could with each of their residents.
So in that same vein, Lynn, how can a family know that the appropriate type of technology, whether it be a generator, is in place so that they know that, if the power goes out, the facility will be cooled, or that, their resident will be, in an area that is keeping them safe? How can families know that information?
Well, that's a great question, because as it relates to the power supply in Florida, that's one area that there is a very specific requirement that information be available to the public. And so anybody can go to the website of the Florida Agency for Healthcare Administration, and they have a tool called Florida Health Care Finder, and they can look up the facility, and on the page that comes up regarding that facility, it will specify what is their plan for backup power, and they have to say exactly how many square feet they will be able to cool, how many people they will be able to provide cooled space for, because it's of course not just residents, it's staff as well. And so that is something that was put in place a couple of years ago after a very, very tragic story that I'm sure Mike could expound upon. But that bad facts very, very sad story did result in a very big change in legislation and requirements. And so that is something that all facilities are now required to comply with and make transparent to the public.
Well, thank you so much. And I think everyone could recall the Hollywood Hills issue. And so, yeah, I think that is so important to know and understand as a family member who, has had a loved one in long-term care. What about plans for medications and people who are, have medical needs during these types of disasters? What plans do facilities have in place to ensure enough medication is on hand? What is that like?
Well, that is something that is specified in the requirements for each of the plans that is supposed to be in there, but that's a pretty generic requirement. So that is something that we would encourage people, family members, to consult with the facility about for a specific requirement. And I think Mike might have something more specific to add on that.
Generally, facilities are looking at the medication for each resident. And when they start dropping below, a 2-week supply, they begin the preparations for reordering. When a disaster is anticipated, such as the hurricane, then they're going to be looking at the medications, making sure the prescriptions are filled and that they do have a supply of medications. The regulations itself does not direct them to have so much medication because everyone's different and every requirement is different. Especially with residents even who are on dialysis, the emergency plan that they are constructed has to take into consideration the vulnerability of the residents that they're currently serving. And so if they have a number of residents who are on dialysis, they need to make plans for transportation, how to get this resident to dialysis, and so forth. It's a very comprehensive plan. Hopefully it is well understood by the facility and the facility staff. In fact, they're required to go through a training on that on that plan. So hopefully at the time of the emergency, they will be able to respond appropriately.
Well, that's a good point. I want to shift gears for a minute because we're still in a global pandemic, and I want to know, our families want to know, what guidance facilities are required to follow during hurricane evacuations that might be different under COVID-19. And so particularly now with the extremely contagious Delta variant, do facilities have heightened safety measures that they're currently following?
The infection control methods that they have right now, as far as a COVID positive resident being in transportation, they would be cohorted, not mixed in together with the others. And this is also should be part of that plan in dealing with residents who have, especially since COVID came about, and they're supposed to review those plans annually. And since we have been in this pandemic for well over a year, that should be included as part of a change to the plan to make sure that they are protected, safe. All the PPEs are available for transportation going into the new facility, that they have the PPEs. They carry those along with them, the residents' records. Everything will follow the resident on evacuation. And speaking about that, we have in the state of Florida, an emergency status system, ESS, that's run by the Agency for Healthcare Administration. They will ask the facilities the daily and identify what their status is, such as a hurricane. What type of damage did you have? Is your power outage, your generator working, and the like? And so that information is centralized. We, as the ombudsman, have access to that system. So we can find out the information. If they're evacuating, half of their staff or half of their residents, we'll know that they have evacuated, where they're going, and we'll be able to help and assist family members find out what's happened to their loved one. Also, in a post evacuation, we're often tasked with trying to identify those residents who have maybe been moved into a different county in a different area. With our ombudsman volunteers, we're able to go and visit them and make sure that they have everything that they need and communicate back with family members.
Okay, that's very helpful. And I just want to remind our audience that if you have questions for Lynn and Mike, please submit them in the Q&A feature so that we can get to them toward the end of the event. Lynn, I want to jump back to something that you mentioned about environmental control rules earlier on. And for nursing homes and assisted living facilities, you mentioned that there are specific space requirements and square footage requirements for emergency power and preparation during a natural disaster. Can you elaborate on how the residents would be transported or safely distanced in a sister facility if that was necessary?
Yes. What the regulations require for the environmental controls is that in a nursing for residents from a nursing facility, they would need to be provided 30 square feet of cooled space. I suppose heated too, but our regulations in Florida only care about cool. So it has to be cool to 80 degrees and not above 80 degrees. And for assisted living facilities, it's 20 square feet per resident that needs to be cooled to 80 degrees. So yes, where there must be evacuations, and those evacuations more often than not are to a related facility. If it's a facility that is owned, has a corporate ownership, and they can go to another part of the state where the disaster hasn't hit, then they are still, there should be not an issue of being compressed space-wise, because they're going to a place that is not having to run on a generator. Now, the rules do allow for increased capacity of those facilities, of the receiving facilities, for some period of time. I think it's up to 15 days after a disaster. So they may be over their maximum capacity for some shortage of time, but there should not be an issue with the distancing of the residents, because they're not under emergency power.
ACA
Okay.
will also go into these facilities, and they will be observing the spacing requirement, making sure that the resident can be attended to. You have residents that need a Hoyer lift to get out of bed and so forth. And if they see that there's a spacing issue, they will address it on site.
So are family members notified if their loved one is moved from their facility to another?
What we can
That is
tell
a
you,
requirement.
oh, go ahead, Mike.
No, that is a requirement that they notify. That's part of the plan. And part of that plan includes the communication, communications to family members, guardians, durable power of attorneys, communications to the emergency management office, communications to ACA. And so that is a requirement that they notify. In a hurricane, we have some time. Oftentimes the decision is made at the last moment. In areas where there's an evacuation because of low-lying area, because of the tidal surge that's going to come, we know it's going to come, they may issue a mandatory evacuation. Generators don't work well underwater. And so they will go ahead and make a decision to move out. If it's just a wind and rain factor and their building is certified for a Cat 5, they may decide not to. And as Lynn mentioned earlier, it is best not to move residents, especially residents with dementia. It is so traumatizing to them. And there's quite a few studies out that shows that the increased mortality in a 30, 60, 90-day period from a move those numbers are relatively high. They're kind of frightening. So facilities don't want to move unless they have to move. And sometimes that decision is made at the last moment. You know how hurricanes change at the last moment. Comes in as a storm, next thing you know, it's a full-blown hurricane. Already had one this year.
We are unfortunately all too used to that in Florida. I think that segues really well into our next question, and it's really more about the family's decision about the safety of their loved one, and if they decide that they want to bring their loved one home during an evacuation in preparation for a natural disaster, what is the process they should follow in order to do that safely?
They really need to get with the facility on that, because there's a lot of things that come into play. There's a bed hole in a nursing home that's available to them. For Medicaid residents, even if they don't pay for the bed hole, they would be entitled to the first available bed on return. That doesn't play out necessarily for a Medicare resident. There may be some insurance ramifications for this. If you have insurance, will the insurance company pay for that? Will they be able to be readmitted, the Medicare resident readmitted? Do they need to go through CARES and get a recertification? There's just a lot of things that can have an impact there. So the family members really need to discuss that with the facility, to ask those particular questions. How will this affect my payments? How will it affect their eligibility? And that's so unique to each individual. So we can't really make a blanket statement on that, other than talk to your folks at the facility first. They'll help you out.
Okay, no, that's great advice. And Mike, you touched on some of the scientific information that we've seen about the traumatizing impacts when residents, especially with dementia, are moved, to an alternate location to weather a storm or the like. What precautions do facilities have in place to minimize those effects, if that is the best course of action?
Well, generally, they're going to try to address them, make contact with them, try to keep them calm, help them understand. Hopefully, they'll be bringing their staff, so it'll be the same staff that will be dealing with them. And generally, that's the case when they go to a new facility. The staff move with them, so that's a familiar face. They know what their uniqueness are, the things that they like, don't like, and will be able to accommodate them. It's a difficult time on a transfer or a evacuation, and try to understand the residents, who they are and what their needs are, and giving them the assurances is probably the best you can do.
Of course. Yeah. Lynn, is there anything you have to add to that before we go to the audience for questions?
Yes, I would add that identifying residents with Alzheimer's or related disorders is something that, in particular, assisted living facilities have to include as part of their plan. And so I think that that's terrific. That's a recognition of the negative effects that these disasters have on people with those conditions. One of the things that one of the studies I was reading mentioned is that, for instance, one way to mitigate this is to not always have the weather channel with that cone going constantly in the background, and this voice of doom as to what's coming, that actually is just elevating the level of stress for all people, but in particular people with dementia conditions. And so these are things that assisted living facilities in particular are supposed to think through ahead of time and plan ahead of time, so as to minimize the disruption.
That's a wonderful point. That's great advice. And I think that personally, I can speak to that. The environment plays such a huge role in a patient with dementia, and what they're perceiving and what they're feeling. So that's very important. Michael, did you have something to add?
No, I don't. No, I don't. That is such a good point. Transfer trauma happens not only in disasters, but in other areas. And there have been a number of studies done on that that indicate what we wouldn't normally think of, but it can have a very devastating effect on residents. And so being mindful of that, who to evacuate. And sometimes it's good to evacuate the others, but keep the demented residents in place, sheltering in place.
Mm-hmm.
You're going to have to weigh the factors there, and so family members be heavily involved in that discussion.
Yeah, great points. Wonderful information for our audience. I see we have a question from Nancy. She wants to know, what amount of time does the facility have to alert the family about evacuation of residents? Is there a set amount of time on that?
Lynn, I don't believe that there is. I'm not aware of one. You were perusing the law more closely.
Right. No, there is not. It's just a requirement that there be a plan in place to notify the residents. And I think, as Mike alluded, ideally that would be well in advance, but in practice that just may not be practicable. But I would put a plug for our program in here too. If if the worst scenario were to happen and a storm were to hit and a family member could not reach their loved one and had concerns about what the status of that facility was and those residents, that is something that we can help with. That is something where we would have access to that emergency system that Mike mentioned, and we would be able to inform the family member as to whether an evacuation had taken place.
Okay, no, that's wonderful. We're getting a question from, I'm so sorry. We're getting a question from John. How far can a facility evacuate my loved one to? Is there a set distance or a time specified on that?
There's not a set distance on the evacuation. Of course, they're going to want to make sure that the evacuation is out of harm's way, maybe outside that cone or the immediate danger of that cone. Some of them have sister facilities in other states, and they will just transport them. Through Michael, we had one that got them rooms at the Hyatt, the Marriott Hotel in another city, because they didn't have a sister facility, and just thought this would be a good idea.
Mm-hmm.
That seemed to work out well.
Well, I have another question here from Sophia. I have both parents in a facility. How can I ensure that they are kept together if an evacuation is needed?
I would think that making sure that that is the desire of the family member talking to the facility. It is not good for them to be separated. Now, there may be some medical conditions that may force a change, such as one needing dialysis, another not, one having COVID, the other not. But I think that speaking with the facility and insisting, if you will, that they be relocated together.
Yeah, it seems like communication is really a big part of this, direct communication with the experts involved with your loved one's care, the caregivers who are seeing them directly. What do you have a recommendation about who at the facility, other than obviously direct caregivers, maybe you should speak with about disaster preparedness questions or any plans that they might have?
Well, the social service director, the administrator, the director of nursing, all should be trained in it. And so the one probably most likely to do a lot of the logistics would be the social service director.
Okay. Let's see, we are getting so many good questions. I have a question here from Kim. How and who ensures the medical records and personal items are sent with the resident? And can the family decide to take the loved one home? And will the facility make sure the home is safe for placement? That's, wow, 3 questions in one. Let's start with the first part. So how and who ensures that medical records and personal items are taken with the resident?
Well, the medical records, that's part of the plan. The medical records are to go with the resident. Personal belongings, not necessarily, be space available, I'm sure. Very limited personal belongings would be taken. And if there's some things that are just absolutely essential that the family member believes wants to go, I think that they can make that request, but it won't necessarily be honored. That in a crisis situation, the resident goes out first, records with them, medication with them, and the like. And what was the other parts of the question?
So the second part of that question was who determines if the personal home is a safe place for the resident to be taken, if that's what the family is wishing. And I'm not sure that that is necessarily the role of the facility. What is your thought?
No, it's not. It's going to be the once the resident is removed from the facility by a family member, the family member takes responsibility for the resident. Now, of course, if they know of certain circumstances and the facility knows that this is not a good thing to do. There are some other avenues to approach that, but generally the responsibility lies with the family.
Okay. So we have another question from Terry. Lynn, maybe you could help us with this one. How soon after a storm passes can families get an update from the facility about damages or and the safety of the resident?
Well, again, that's not going to be something that's set out in law or regulation, because every situation is so individual. But the facility is required to keep the Agency for Healthcare Administration updated as to their status. And so if again, for some reason, I mean, if family member can't get in direct touch with the resident or with the facility or the facility administrator, that is something that we can help with. But the facility should have a plan for providing this information to all of the family members directly.
Okay.
Let me add also is that before the facility evacuates, before they can come back to that facility, AHCA, Agency for Healthcare Administration, will inspect the facility and make sure that it is safe before they authorize the return.
Yeah, that's a great point. So many great questions and just wonderful information for our audience today. Mike and Lynn, do you have anything to add before we wrap this up?
No, folks are welcome to call us. We're here, and we're here for the residents. And even if there are complaints that have taken place during the evacuation that they want to have addressed with us, if there's a way that we can solve that complaint, we certainly will. If it's a regulatory issue, then we can refer it to Agency for Healthcare Administration to look into it. Because when you have these sort of things, after what I call after action reviews are helpful for the future. We've learned the lessons, we've learned the mistakes, and we prepare for that next time around.
And I would echo that that's what we're there for. We can help with these after the fact. And so I think of our ombudsman as the family. If family can't be there on the ground, we can be. And so that should be a comfort and a resource that is very welcome to people whose loved ones are far away, because that's something that we do. Mike calls us the best kept secret, and we don't want to be secret anymore. We want everyone to know that we're there, and we have people that will check on your loved ones for you if you can't.
And we want more folks to volunteer to help us do this wonderful job.
Right. Yeah, no, that is wonderful. And I'm so glad that you mentioned that. Yeah, I want to remind all of our attendees, if you're concerned about the safety or well-being of a spouse, parent, or loved one who lives in a nursing home or long-term care facility, please contact the Florida Long-Term Care Ombudsman Program. The number is 1-888-831-0404. We will put this information in the chat for you. You can also contact the Florida Department of Children and Families Adult Protective Services hotline at 1-800-962-2873. And as Lynn mentioned, the Agency for Healthcare Administration is responsible for the regulation of Florida's nursing home and long-term care facilities, and they can be reached at 1-888-419-3456. We will add this contact information to the chat, and it will be available in this video once it's posted on the AARP Florida YouTube channel. I want to thank our wonderful guests today for taking the time to discuss disaster preparedness and long-term care. If you are a family member, would like to share your experience in long-term care with AARP, or if you're willing to speak with media, please reach out to us through email. We'll put this in the chat for you as well. It's flaarp@aarp.org, and we will be happy to reach out for you. Thank you for joining us today for this edition of AARP's Disaster Preparedness Series. This video, again, will be available for you on the AARP Florida YouTube channel. And remember, you can find more information about disaster preparedness on our website. Just visit us online at aarp.org/FL. That's aarp.org/FL. Thanks everyone for being with us today, and we'll see you next time.
Thank you, Jamie.
Thank you.
Have a wonderful day.
You too.
Bye.
Bye.